Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Ziva Fertility is conducting a free camp for patients suffering from infertility. We are conducting this camp in the month of May on every Saturday at Kompally, Sanat Nagar, Banjara Hills and Manikonda. Included in this camp are free registration, consultation, counseling and semen analysis. Subsequent treatment options will also be suggested to you and you can avail this opportunity. Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. During fertility treatment, sometimes a patient may be advised surgical intervention or certain scans that could be required to monitor the progress in a patient. So let's try to understand the difference between ultrasonography and other surgical procedures that could be advised to you. So the most common thing that fertility specialists utilize to monitor you is ultrasonography. These are based on just a probe that goes into your vagina, and based on sound waves they are trying to see how the shape of a uterus is, what is the progress in the ovaries that is happening, how many antral follicular counts are there, if there is an endometriomas which is a complication of endometriosis, if that is present, if there are no follicles growing and it is correlated with a blood test as well. All those things can be assessed with an ultrasonography. Usually a doctor will call you on day 2 of your cycle and do an ultrasonography because that is when the ovary and the endometrium are getting ready for the next period. So that's a very good time to assess the antral follicular count, as in how many follicles are growing for the next cycle and what is the shape and the state of endometrium, because we need to assess whether it has shed properly from the previous period. So all these things are assessed by an ultrasonography machine. It is a very important tool when coming for follicular study, that is to understand how a follicle is growing in response to medications that are given to you. This is very critical, especially in IVF, when medications are given to grow your eggs in the ovaries and to decide when to retrieve them from your ovaries. So ultrasonography is an extremely critical and important tool for your fertility specialist to decide on the path that they take for your fertility treatment. Let's move on to the next one, which is hysteroscopy. It is one step ahead of ultrasonography because a very small telescope with a light at the tip of a thin rod is passed into your vagina and your endometrium can be very carefully looked at. Now what it's trying to do is trying to assess the shape of the uterus, if there are any fibroids, polyps, if there are any scars from previous surgeries or endometriotic scars. All these things can be detected by this hysteroscopy. In addition to that, an operative hysteroscopy can be performed in such situations, especially if there is a fibroid or if there is a polyp or anything inside it. Operative hysteroscopy can be performed to remove these conditions that we talked about. Many a time, patients get pregnant on their own after operative hysteroscopies are performed, especially for fibroids. They can also be used to assess the tubes to see if there is any damage, scarring or even any blockages because of fibroids. So operative hysteroscopy is a very important tool as well. Now this can be done after a failed IVF also, because doctors want to assess the endometrium to see if there was something in the endometrium that caused this IVF to be a failure after embryos were transferred. So hysteroscopy is a very strong tool for doctors, very easy to be done. There is no surgical incision, bleeding is not there, recovery time is very fast. So please do not hesitate to get it done, especially after you've had miscarriages or the doctor has said you have fibroids, you've had failures with IVF. Do not hesitate to get a hysteroscopy done. Moving on to another important procedure called laparoscopy. Laparoscopy is one step ahead of hysteroscopy. It's done through the abdominal wall. Again, it's not a surgery. It is a very simple procedure where incisions are made from the stomach and small rods are passed with light at the tip of it and a scope. This is observed on the monitor and then the doctor decides where the problem is and tries to solve it. If there are endometriotic scarrings on the uterus or ovaries or anywhere else which are actually bringing down your chances of success, these issues can be solved during a laparoscopic procedure. There could be distortions inside the abdominal cavity because of endometrial adhesions. All this can be brought down a little, if not totally removed, but brought down a lot, and your chances of success can be improved. So do not hesitate to get a laparoscopic evaluation or any correction during laparoscopy done if your fertility specialist has advised that for you. If you have any more questions, please feel free to contact us. Thank you. We strive very hard to make these informative videos for you. Please encourage us by subscribing and liking our videos. Thank you.